Hey, Lizette, how are you?
I'm good. How are you?
Good. Welcome back.
Thank you. Thank you for having me today.
Thank you so much for joining me. And to everyone at home, thank you so much for joining us. My name is Meg Storm, and I'm the editorial director here at Edit. We're here with part two of our 4-week series, where we are talking about different at-home and professional treatments. So you can hopefully start off the new year with a new and great skincare routine. And my partner for all of this is the supremely knowledgeable Lizette Ludwig. And Lizette is an aesthetic nurse, an injector, and RN based in California. And if you're not following her on Instagram, her handle is at Lizette Ludwig _RN. And she has just like a ton of beauty and wellness and skincare tips that I personally can't wait for you to post.
Oh,
I'm
thank you,
your
Meg.
biggest fan and
I
follower.
appreciate the welcome. It's so fuzzy, warm and fuzzy.
Oh my goodness, no, you deserve it. And so I would love to just have you quickly introduce yourself to everyone.
So my name is Lizette Ludwig, and I am an aesthetic registered nurse, and I have been in the aesthetic medical space it's been over 12 years now. And I've, through my time in aesthetics, I've really found my niche, and I really feel like it's combining these non-invasive type of treatments with treatments like injectables, like whether it's Botox or fillers or things like that. That's when I really think, what I really love about it is the minimal downtime, and
Definitely.
the great results that we get from combining treatments. And we have so much at our fingertips now, so it's just we're lucky.
We are lucky. And it's
Yeah.
like, and you can do it kind of both ways. You can see someone like you and get the professional treatment and then
Yeah.
continue to maintain your skin at home, which is why I love kind of this series that we're doing so much, because we're really kind of diving into both ends of that.
Exactly.
And so for anyone who was with us last week, you know that we talked about microneedling and derma rolling. And if you missed it, you can find it on our IGTV, because it was a really fun conversation. And this week, we're talking about kind of an equally amazing treatment combination, which is professional or medical grade chemical peels compared to kind of the at-home peel pads and enzyme treatments that you can find at Sephora or Ulta or wherever you buy your skincare. And so one thing we'll just note again is that if you're kind of considering any of these things, or especially considering anything at home, we always recommend that you consult with your dermatologist or an expert like Lizette, just to make sure that it's safe and effective for you and your needs. But one of the great things about some of these topics is that they really do have a lot of benefits and kind of a lot of appeal to different types of skin tones and skin concerns.
Exactly.
So to
Does
start,
my light keep turning off, or is that just on my end?
I'm still seeing you. So
Okay,
I
good.
think it's just on your end. Yeah, no,
Okay.
I've been seeing you the whole time.
Okay, good.
Yeah, I'll let you know if that
Okay.
changes.
Sorry about that.
So to start, Lizette, can you kind of, first of all, actually, if anyone has questions while we're talking, please feel free to either drop them in the comments or in the Q&A, and we will keep track and answer them as much as we can. And then otherwise, would love to dive in, Lizette, with kind of what are medical grade chemical peels?
So there's so many on the market now, so it can get confusing, even for providers like myself, where it's like, there's so many different lines. And so you just kind of have to pick and choose. There's always different strengths of peels. So there's light, medium depth peels, and then deeper peels. I personally like to stick on the light and the medium depth peels. And I think for the most part, even dermatologists would probably agree that deeper peels are there for a reason, and it's nice that we have them. But if you can kind of start off with something that's, a little more conservative to see how your skin reacts to it.
Yeah.
Unless there's a specific skin condition we're trying to treat, like melasma is one of those, and peels really do well with melasma, which is that hormonal type of pigment. So sometimes for those types of patients, it might be worth going to the stronger peel if they're really looking just to, because melasma patients is something usually that they struggle with.
Right.
So they tend to know their skin really well, because they've done treatments in the past or things like that. So it's nice to have those deeper peels for patients like that, or patients with deeper acne scars. But the light peels, I would say, are always a good place to start if you've never had a peel.
Okay.
You can't go wrong with that. It's I would say those are just like 3 to 5 days of downtime. Typically, they involve ingredients like alpha hydroxy acids and beta hydroxy acids, which are pretty tolerable for almost all skin types.
Great.
So that I would say though that would be like the lighter peel. It's pain-free, you know, very minimal downtime, but you still get a brightening, you know, result. And typically I say with these peels, you're going to need multiple, and you'll know when you do one, you're like, okay, I can see a difference, but I think I need more, you know.
And what would be the cadence of treatment if you were to get a series of lighter peels?
Like 3 to 5, like 3 to 5, maybe like 4 to 6 weeks apart. And
Great.
you know, when you do any peel, whether it's a light peel or a deeper peel, you have to be really proactive with how you're caring for your skin afterwards, because that's important, and specifically sun exposure. So really good sunscreen. Make sure, you know, you're following your providers at home, because there's always at home. It's usually involves like a really good moisturizer and a really good sunscreen.
And does that start ahead of the treatment itself? So do you kind of start, should you lay off retinols or anything more kind of active before the peel, and then afterward as well?
That's important, yeah. We typically ask that patients discontinue their retinols and their glycolics for at least 3 to 5 days, depending on their skin. And they usually know. If they're sensitive, we're going to say probably a week.
Okay.
But you know, if they've been doing these treatments and they're used to it, usually 3 days is enough. So it's anywhere from 3 days to a week that we'll ask you to discontinue those retinols and glycolics and things like that.
Okay. And then just in terms, to give people some orientation, in terms of concentrations, what is the concentration of an AHA or a BHA peel that you would get professionally?
Well, it depends. For example, like these ingredients like lactic and salicylic and glycolic, they're all in the at-home peel pads too.
Right.
Exactly, in much lower concentrations, and each peel is different. So it's hard to give you an exact concentration of like 5%. Each peel really is different. For example, like I have this is one that I typically use on my patients. It's the VI peel. This is a really popular peel, and even this peel, this brand has, you know, they have like a light peel, a medium, and then their deeper peel.
Gotcha.
And each of those have different concentrations of the solution in it. And typically when you're getting into like the medium peels, anything that usually involves TCA, I don't know if you've heard of that ingredient before, that typically goes deeper than the epidermis. So I will call that more like a medium to, you know, a deeper peel. And even with that, with the different concentrations of TCA really determines, you know, I don't know if there's an actual number that determines like a light versus a.
Gotcha. Yeah.
You know,
totally.
Because with different brands, they all have slightly different, you know, concentrations of and mix of ingredients too. And that's kind of what makes a peel unique as well. You know, that's why some peels are greater for pigment, and some are really good for wrinkles, and some are, you know, because ingredients matter. You know, like with wrinkles, I would say go for more of the TCA, but TCA sometimes isn't the best. It's not the most ideal ingredient for darker skin types. You have to really be careful because you can pick, you know, and I've actually, even though my skin looks pretty fair, since I do have that olive skin tone, I have pigmented before with peels.
Interesting.
And usually it's something, because I have access to so much, it resolves quickly because I know how to care for my skin and things like that. So it is temporary. It's something called PIH, which stands for post-inflammatory hyperpigmentation. Yes. And so when you get something like PIH, it's usually on the surface. It's not very deep. So it's usually can be, you know, it's no need to panic. It's usually within, if you're caring for your skin properly, within 4 to 6 weeks, it should resolve on its own.
Okay. And so in terms of kind of what to expect afterward, you said about 3 to 5 days of downtime for a lighter peel. And are you expecting kind of like a little bit of flaking as the skin actually heals?
Absolutely. It's more like flaking and dryness with a light peel. So flakiness, dryness, and just making sure that you are using a good moisturizer. And if your provider gives you, like, for example, most peels have these little kits And they have kind of step 1, do this, step 2. So they provide you with like a cleanser, a moisturizer, and a sunscreen. So I highly recommend that if you're in-office peel, and if your provider recommends these at-home, potions, whether they're lotions or sunscreens, use them, because typically there's a reason.
That makes sense.
And it really does make a difference in the downtime, the healing time, because if you put something on your skin, just like we talked about with the microneedle, if you use something that you have at home that might work great, I would ask the provider first, because you don't know, sometimes these serums have ingredients in it that could really cause something like skin irritation.
Absolutely.
And then it can really mess up the treatment,
Yep. And then when it comes to a medium peel, is the downtime more like 5 to 10 days or 7 to 10 days? Is that usually what you're looking at?
Like 5 to 7.
Okay,
I would
great.
say like 5 to 7. So good solid week,
Okay.
So just add a few extra days. And this one typically does involve more peeling time. So I would say the light is more like dryness, flakiness, and the medium peel is, I would say, you're actually peeling. And sometimes people will call and they'll say, I had a peel and I'm peeling. I'm like, that's what's supposed to happen.
It's doing what it says.
Yeah, but it is hard. It is kind of hard to go through the process sometimes of the downtime of the peeling. It's not that fun,
No, it's
and
not.
like, oh my God, you see your skin, peeling off. But when it really does come off, I mean, the results are pretty immediate with peels. That's the nice thing.
Yeah.
When the skin is back to its normal phase, which depending on which peel, let's say it's about a week, within that week, I mean, even if you're a little red, you'll notice that your skin definitely looks brighter. It looks smoother. Your pigment will look, much lighter. So now it's all about the skin maintenance and how you're really taking care of your skin, because if you're exposing your skin to the sun, it's very sensitive. Your skin becomes very photosensitive after a peel. So you have to really keep that in mind.
And you mentioned this a little bit, but in terms of the skin concerns that it treats, acne scars, lines and wrinkles, dullness, like texture concerns, kind of all of the above?
Yes, it really does treat all of those things. You just have to do multiple treatments depending on, what type of peel you do. But I would say if you did a medium peel, you're probably anywhere from, I say, 1 to 3 peels. And then the stronger peels, you probably sometimes only need 1.
For a truly deep peel, right? It's kind of like a once in a lifetime moment.
Exactly. And there's different categories in those deeper peels as well. Like I used to do a deeper peel for my melasma patients. Which was called the melanage peel, and that was like a once a year type thing.
Gotcha.
You do it once a year, and it really had all these brightening ingredients that really helped with the melasma.
Yep.
And you have to be careful too, because you don't want to overly strip your skin constantly. Right. You have to let it repair itself as well.
Absolutely.
Yes,
and so
sometimes once a year is enough for those deeper ones. But then the other ones could require 1 to 3, or the lighter ones 3 to 5.
Okay, great. And so if you had an event coming up or a wedding or something like that, when would you kind of recommend people ideally start kind of a treatment protocol if they were going with peels?
I would say like 6 months before.
Okay.
Yeah, that would be, I mean, if you could start earlier, if you really wanted to start like a year before, because I know brides like to plan ahead.
Yes.
And that would be nice, to come in for a consultation and see what you want to address. But you'd be pretty safe if you started 6 months before, because you can get a few in.
Awesome. That's great. And so when it comes to the in-office treatment itself, how long does it usually take? Are different peels left on the skin for different lengths of time?
Yes. So typically what it involves is you come in, we have to always make sure your skin is very cleansed, and then we prep the skin with acetone solution. And then from there, I'll usually give my patient a fan. Most of these peels these days, they don't sting. Some of them do, but it's really more the smell of it, I think sometimes, So once we apply the peel, usually these lighter to medium depth peels, you'll leave on for anywhere from 4 to 6 hours.
Okay.
And your provider will write that down for you, and give you all, your post-care instructions. And then once we put the solution on, we have them sit for a little bit just to make sure that everything's okay. They're tolerating okay. And while you're going over the instructions, you're kind of watching their skin. Everything's good. typically you give them their little packet and they go home.
Okay.
And they are to follow these steps at home to complete this at home. So
Yep.
a lot of this now, you know, it doesn't fall on the patient because the provider is still there for the patient, but a lot of this is stuff patients can actually do with instructions on their own. That's kind of nice. You send them home with it and they, you know, they wash off in 4 to 6 hours.
Yep.
And then usually there's either like a pad or solution they may have to reapply at that time. And then there's some steps for them afterwards, but anywhere from 4 to 6 hours, we usually say you want to leave on those peels.
Great. And then when it comes to kind of what to expect afterwards, obviously we talked about the downtime associated with the different ones. And you mentioned in terms of side effects, flaking and dryness and peeling are all very common. And then potentially a little bit of PIH, depending on your skin type and how you react to it.
Exactly. Sometimes that can happen. And again, you know, if you put something on your skin, that can cause some irritation, sometimes some redness and inflammation is a part of it. But sometimes that's just a part of it anyway, because it is a solution. Essentially, you know, I mean, it's causing some trauma to the surface of your skin. So it could potentially, you know, cause skin irritation as well. So sometimes we may prescribe simple things like cortisone, like you know, hydrocortisone over the counter works really well with that.
Yep. That's great. And is it just for the face, or can you do chemical peels on other parts of the body? You
can do it on other parts of the body as well. Chest, neck, back, shoulders, that's all a really common area.
Yeah.
I would say, I mean, those are the most common areas. And sometimes people will do arms, but you know, we do have laser devices for things like that as well. Sometimes we may opt for that. It's a little, it's just people see better results with lasers on the body, but chest, neck, shoulders, or like back area are all very common areas that we treat with peels too. But those areas heal a lot differently than the face. So you do have to be more conservative when you're treating areas like that. You may not do as many passes on these areas. Yeah.
Could you theoretically, though, do a face and neck treatment in the same day and it would just kind of be applied differently? Okay.
Yes. I almost always try to treat the neck when I have enough solution, you know, and I almost always kind of go down to the neck if I have enough. That's usually not enough for the chest, so that we may need another, open another vial for that. But typically always I try to go down as much as I can for the neck. Okay.
Great. Yeah. And so in terms of how long results last, obviously if you're kind of doing a series, that's going to prolong how long you see results for. But what is usually like, how long do you get to enjoy the glow after you get kind of a series of treatments with peels?
I mean, you'll get that immediate glow. And you typically, it's really all about how you maintain your skin.
Okay.
I mean, it could last, you know, it could last months if you're being really good about your sunscreen, if you're being really good about your skin maintenance routine, which usually involves some retinol, some vitamin C, or some brightening serums.
Yep.
If you're really doing all that, I mean, it starts to become a lifestyle too. Like, and I know that might sound weird, but once you start taking care of your skin, it really does, like, you'll want to be on a maintenance plan. So, you know, you kind of get in the routine where you're wanting to do something to your skin maybe every 3 to 4 months, unless you're on like unless your provider recommended, let's do a series of treatments.
Definitely.
So you might be seeing your provider 4 to 6 weeks later, but your results should last a good 3 months or so if you're taking care of your skin. And by then you might notice, okay, I think I need another one.
It's time. It does suck you in. I feel like once you see the glow, you're like, oh, how can I look like this all the time?
And I know, and you know how good it is. So you're like, I want it again.
No, it's like when your Botox starts wearing off and you're just like, oh, my life, like it's time.
Yeah, it's time. Like you just know. It's hard to really say a time, but you just kind of know. And usually it's in that 3-month mark.
Yeah. Well, and also kind of speaking of extending the results or kind of maximizing your results, there are some kind of at-home versions of some of these things that can be great for kind of helping to maintain your skin in between appointments. And so on the kind of at-home end of the spectrum, usually it's more so, they might be called peels kind of for marketing purposes, but oftentimes it's more of like a chemical exfoliating treatment in the form of a pad or an enzyme treatment or something like that, right? Yeah.
And I have 2 of my favorites that these are at-home exfoliants that I use and I love. This is a M61.
Those are amazing. I love
Yeah,
those
they're
too.
amazing. These Power Peel Glow Pads. And then, you know, you might have things like this one's a Trisha McVoy. Yeah.
Yep.
Where it's like a brightening pad. I love this one too, but there's so many great ones on the market, honestly. So with these, you do have to keep in mind, you know, that a lot of them say use every day. I don't really recommend exfoliating every day because
Yep.
you really have to maintain your skin's barrier, you know, and you can really overly strip your skin.
Absolutely.
And you know, it can lead to breakouts, it can lead to dryness. So typically, depending on your skin type, if you're kind of, I would say, more normal to dry, I would say 1 to 2 times a week is good for exfoliating.
Great. Okay.
If you're on the oilier side, like if you have oily skin, then you may want to exfoliate 2 to 3 times a week.
Okay.
So it really just depends. I don't think I would recommend daily for anyone, but sometimes there's things like the glycolic cleansers that can be exfoliating, and something like that you can use every day.
Okay.
Like the cleanser. These pads usually require that you leave on overnight.
And they're obviously a higher concentration of all of those ingredients.
Yeah, versus like what's in a cleanser. So I would recommend 2 to 3 times if you have oily skin. If you have dry skin, 1 to 2 times is enough.
That's great. Okay. And then when it comes to exfoliating in general, there's chemical exfoliants, which is what we're talking about. And there's also physical exfoliants. So can you just quickly kind of orient people as to what the difference is there?
Yeah. So this is considered a chemical exfoliant.
Yep.
A pad or a solution, right? Or it's a solution could even be like the toners, you know? So that would be, and then a physical exfoliant is like a scrub. Like there's so many, and they make some really good ones on the market now. Before it was just like, I know I have to say it, but it's like the St. Ives, you know, scrub where it's like really thick. It's really not good for your skin because that can cause people could really tear their skin with that.
Right.
It can cause micro tears, and you don't need that much exfoliation. There are some really good, more, I would say, that are a little more gentle exfoliants now that have really these like little micro
very fine beads.
And I think that's typically fine, but that is an exfoliant.
Yep.
So if you're using that plus this, I think that's too much, you know. So maybe just you can use that cleanser once a week, and you can use a pad, you know, once a week type thing. So there is a difference. I think right now the chemical exfoliants are really popular.
It feels like it.
Popular than the physical.
Yeah.
But the physical are still good too. You just have to use a gentle form of it. It's just, I think before what was out was just thicker beads, and they were
too abrasive
down the skin. Yeah.
Yeah, that makes sense. And if you are using a peel, one of these pads at night, overnight, should that be the only thing that you're putting on your skin for that night?
If you're sensitive, yes. And typically I would say yes. Sometimes if you know your skin, like for example, myself, like I know that I can sometimes put a little more, and then I might just add a little retinol, but that's something you do if you know your skin well and you know you can tolerate it, but not everyone can, you know? So typically if you're just starting off with these type of pads, I would just cleanse, put the pad on, let your skin absorb it, and go to bed. If you feel like you want a little moisturizer, you can certainly apply a little moisturizer or hyaluronic acid serum. That's totally fine.
Okay.
Not everyone can tolerate using. It's probably best to alternate. You know, then the next day you can use your retinol or, you know, your serum.
That makes sense.
Yeah, that would be ideal. You know, and I think most people, it's safer if you're doing something at home to do it that way.
And to just be cognizant, and then it's kind of like, then you know every other night kind of what you're doing and what ingredients you're using. And so I know you mentioned in the beginning that a lot of the ingredients found in these at-home products mirror what you'll find in kind of a medical grade professional product. So is it the same kind of AHAs and BHAs that we talked about? It's
the same. It's just you know, the strength of the ingredient isn't as strong. So, but it's the same. Lactic acid is a lactic acid. A salicylic is a salicylic. Yeah. It's just the strength of, you know, of the percentage of the actual ingredient in the at-home is obviously a lot lower than the in-office.
Yeah, makes sense. And I know you mentioned in terms of the pads, I feel like are one of the like easiest, most foolproof ways, but you'll find those ingredients in, like you said, cleansers and toners and even serums in some cases.
I know. And it can, because skincare is such a thing now, you know, and I just think that sometimes it can get overwhelming because you want to buy everything. You want to have like all these things, and then you're like, my cleanser has this. And so you got to look out for that. You could be really over exfoliating, and that certainly is a thing. And some signs of that over exfoliation are, you know, when you're just feeling like you feel like your face is a little bit on fire, like it almost feels like stinging, and you might get a really tight waxy kind of effect. That's also another sign that you might be over exfoliating. When you put like even just your moisturizer on and it stings, you know, those are all signs that you could be using too much. So check out your ingredients in your cleansers, in your serums, and in your pads. If they all have exfoliating ingredients, you might have to pick and choose which one you're using, you know.
That makes sense. No, definitely. And then obviously same with a professional peel, you want to really be diligent about sunscreen the days after you're using it.
Yes, that is so important. And specifically with like chemical peels and lasers, it's really important that you do find a good sunscreen, and look for one with zinc oxide and titanium dioxide. Okay. That's really important because it really does protect both the UVA and the UVB rays that we need. You know, we need that protection, because you don't want to do all that work and then go in the sun one day and then it just all comes back.
You undid all of it.
I know, it's kind of a bummer too. It's like, no.
It's like working out. It's like it takes so long to get results, and then they undo themselves so quickly.
They do. So yeah, so it's kind of a bummer. So yeah, I would definitely, and it just takes one time, you know, of being in the sun. So yeah, just really pay attention to the sunscreen, and reapplying is super important too. You know, I know we're in the winter months, but when you get into those hotter months where the sun's really out from, you know, 12 to 4, and that's when it really peaks. So if you put your sunscreen on at 8 a.m. and now you're going for a walk at noon, highly recommend that you reapply.
That makes sense. No, I feel like it's especially when you have like makeup on and stuff, it's hard to remember to do that, but it's not just for like days you're at the beach. Like it really is every day.
It really is like every day. I know it took some time for me to really figure that out as to how you're going to reapply, like you said, when you have makeup on. But now there's all these great, there's like the brush on, and there's some spray ones that are like spritzers, you know, so there's definitely ways to do it. Yeah.
No, I think it's just, to your point about it, like becoming a routine. I feel like once you get in the routine of doing it every day, then it's just like part of your lifestyle.
Exactly.
Well, thank you so much for your time today. This was such a fun conversation, as always. And for anyone who's interested in learning more about chemical peels and chemical exfoliators, we have an article up on EDIT's website with Lizette, where we deep dive into all of this, and we'll post the video there as well in case you missed any of it. And we're excited because next week we're going to be talking about light therapy, which is another really great topic that I think is, again, just something everyone's talking about right now. So
it is
excited to dive into that more. And yeah, thank you, Lizette, as always. It was so great to see you and talk to you.
Thank you, Meg. I really appreciate it. I had such a good time, and I love talking about these things. It's like I could talk all day long about this stuff.
Same, like literally all day long. So I'm so glad we're doing it together, and thank you to everyone who joined. We will see you all soon.
Sounds good. Thank you.
Thanks, guys.
Bye.